London, the number of Delta variant infections has jumped by, in a week to hit a total of, in the out, with the highly transmissible variant first identified in India now making up 99% of all COVID-19 cases in the country, health officials warned on Friday. Public Health England, FI, which has been tracking variant of concerns, VOX, on a weekly basis, said its data shows an increased risk of hospitalization with Delta VOC compared to Alpha, the VOC first detected in the Kent region of England. It also pointed to its previous findings that 2 doses of a COVID vaccine gives a high degree of protection against hospitalization from the Delta variant. FI's weekly COVID-19 variant cases data show that numbers of the Delta variant in the UK have risen by, since last week, to a total of 5 reports. The most recent data show 99% of sequenced and genotyped cases across the country are the Delta variant. Data show an increased risk of hospitalization with Delta compared to Alpha, although FI's analysis shows that 2 doses of vaccine gives a high degree of protection against hospitalization, estimated to be more than 90%, it said. According to the analysis, as of June 14, a total of 806 people have been hospitalized with the Delta variant, an increase of 423 since last week. Of these, 527 were unvaccinated, and only 84 of the 806 had received both doses. It finds that deaths are not high, as the case fatality rate remains low for Delta. However, it points out that deaths tend to happen some weeks after an infection, and it is therefore too early to judge the case fatality of Delta compared to Alpha or other VOCs. Cases are rising rapidly across the country and the Delta variant is now dominant, said Drive Jenny Harries, Chief Executive of the UK Health Security Agency. The increase is primarily in younger age groups, a large proportion of which were unvaccinated but are now being invited to receive the vaccine. It is encouraging to see that hospitalizations and deaths are not rising at the same rate, but we will continue to monitor it closely, she said. The vaccination program and the care that we are all taking to follow the guidance are continuing to save lives. Please make sure that you come forward to receive both doses of the vaccine as soon as you are eligible. Don't drop your guard, practice hands, face, space, fresh air at all times, she added. In separate population surveillance data on possible COVID-19 reinfections offering some hope of long-term immunity, the FI found a low risk of reinfection with SARS-CoV-2, which causes COVID-19. There were possible reinfections with SARS-CoV-2 identified up to May 30 in England throughout the pandemic, out of nearly 4 million people with confirmed infections. This is equivalent to around 0.4% cases becoming reinfected. While we know that people can catch viruses more than once, this data currently suggests that the rate of COVID-19 reinfection is low, said Drive Susan Hopkins, Strategic Director for COVID-19 at FI. However, it is important that we do not become complacent about this. It is vital to have both doses of the vaccine and to follow the guidance at all times to reduce your chance of any infection, she said. FI said there is currently no evidence that the Delta VOC, or any other VOCs, are more likely to cause reinfection than others, but that it continues to closely monitor this and other reinfection data. The FI results follow an Imperial College London-led real-time assessment of community transmission, REACT-1, study, based on home swab tests, which reported on Thursday that the number of people infected with the coronavirus is doubling every 11 days. The Delta VOC is seen as the main factor behind a feared third wave of the pandemic in the UK, with the government delaying lifting all lockdown restrictions by a month until July 19 to prevent hospitals being overwhelmed. Meanwhile, Professor Adam Fenn, a member of the Joint Committee on Vaccination and Immunisation, SCRI, also noted that hospitalizations due to the Delta variant in England have doubled in a week. This variant that has now taken over from the Alpha is clearly significantly more infectious. And regrettably, it is more likely to end you up in hospital if you're unlucky enough to get it, he said. The one bit of good news around this is that the rate of rise of hospitalizations is not as fast as the rate of the rise in cases. So we are preventing a lot of hospitalizations with the vaccine program, but not all of them. This is another piece of really good news, is that if you've had 2 doses of Pfizer or AstraZeneca vaccines, you're more or less guaranteed not to end up in hospital. Ad block test Y.